In this video, we will discuss the mechanism of action of Dexilant, dexlansoprazole. Dexilant is a proton pump inhibitor with dual delayed release technology. Let's begin by taking a closer look at gastric acid production and the role of PPIs. The stomach is lined with many gastric pits. Deep within these pits lie parietal cells containing proton pumps. In the absence of a gastric event, most of these pumps are in an inactive state or not producing acid. When an intragastric event occurs, such as when food is introduced into the system, some, but not all of the proton pumps within parietal cells become active and secrete gastric acid to aid in digestion. It's important to note that not all proton pumps within a cell are active at any given time. Some remain inactive, but can become activated later. If an intragastric event occurs later in the day, the proton pumps that were not previously active or have been newly generated could become activated. Proton pumps that are not active are inaccessible to therapy. Dexilant is the only PPI with dual delayed release technology, which provides two distinct releases of drug. Let's first examine how dual delayed release technology works. In every capsule of Dexilant, there are two types of enteric-coated granules. Each is designed to dissolve at different pH levels. The first granule is designed to release at pH levels greater than or equal to 5.5. The second granule is designed to release at pH levels greater than or equal to 6.75. This results in a plasma concentration profile with two distinct peaks. The first peak is within 1 to 2 hours of dosing, with the second peak following 4 to 5 hours after dosing. Dexilant 60 mg provided an area under the concentration curve at 24 hours that is approximately 3 times greater than lansoprazole 30 mg on day 5. Now let's see how Dexilant works once it is dosed. After dosing, Dexilant travels through the GI tract. The first type of granule is designed to release at a pH greater than or equal to 5.5. Dexilant then gets absorbed into the bloodstream. After traveling through the bloodstream, Dexilant enters the parietal cells, binds to active acid-producing cells, thus stopping the pumps from secreting acid by inhibiting hydrogen-potassium ATPase. Now let's fast forward several hours later. There is still drug available for activated parietal cells. Granule 2 provides a second release of drug that allows for a second peak concentration within 4 to 5 hours after dosing. Granule 2 is designed to release at pH levels greater than or equal to 6.75. Once again, Dexilant gets absorbed into the bloodstream. After Dexilant enters the parietal cells, it binds to active acid-producing cells, thus inhibiting these pumps from secreting acid. Dexilant is the only PPI with dual delayed release technology, which provides two distinct releases of drug. Dexilant is indicated in adults 18 years of age and older for healing of all grades of erosive esophagitis, or EE, for up to 8 weeks, maintaining healing of EE for up to 6 months, and the treatment of heartburn associated with symptomatic non-erosive gastroesophageal reflux disease, or GERD, for 4 weeks. No dosage adjustment is necessary for patients greater than 65 years of age. Important safety information. Do not co-administer atazanavir with Dexilant because atazanavir systemic concentrations may be substantially decreased. Dexilant may interfere with absorption of drugs for which gastric pH is important for bioavailability, such as ampicillin esters, digoxin, iron salts, and ketoconazole. Patients taking warfarin with PPIs may require monitoring for increases in International Normalized Ratio, or INR, and prothrombin time. Concomitant tacrolimus use may increase tacrolimus whole blood concentrations. Dexilant is contraindicated in patients with known hypersensitivity to any component of the formulation. Symptomatic response with Dexilant does not preclude the presence of gastric malignancy. Commonly reported treatment-related adverse events: diarrhea, 3.7%, abdominal pain, 2.6%, nausea, 2.2%, headache, 2.2%, flatulence, 1.8%, and constipation, 1.1%. Please see full product monograph for Dexilant.